Hi, Rose Caiola here with the American Heart Association. For Heart Month, we have a special guest, Dr. Eugenia Gianos from Northwell Health. She is the Director of Cardiovascular Health and Wellness and Nutrition. Welcome, Dr. Gianos. Thank you so much for taking the time today to enlighten our audience and to spend this time with me and the American Heart Association.
It's a pleasure to be here, and thank you for all you do for the American Heart Association.
Well, we have mutual loves, that's for sure, which we'll discuss in a moment or two. But, because it's Heart Month, I think it would be remiss for me not to, of course, ask you some questions about heart disease and how it's still so shocking to me that no one knows, so not many people are aware that it's still the #1 killer for men and women. So what can we, what are the signs and symptoms that that can occur during any kind of heart disease or stroke that we might not be aware of?
Yeah, thank you for raising awareness to this issue because yes, it is the #1 killer for both men and women. We try to raise awareness in women mostly because it's perhaps even more under-recognized than in men, but the reality is that it is important for both men and women to know that this is such a prevalent disease. I would say that the key symptoms are perhaps 3 types. One are the symptoms of a typical heart attack. So that would be, sort of crushing chest pain and shortness of breath, and maybe you get a little sweaty and you're feeling really unwell. That's more of a typical presentation, but keep in mind there's also some atypical presentations where sometimes, especially in women, they may just not feel great. There's some weird feeling in their chest. They feel unwell. They feel very fatigued and uncomfortable. And that could be their presentation, and they really need to be aware of that. And the last one is stroke, which I think very often I've heard patients sort of say, well, I had some symptoms and I thought they might go away, and I waited some time to see. But if you have symptoms of weakness on one side of your body, or on one side of your face, difficulty speaking or finding the words, a sudden imbalance in your gait, all of those things could be a sign of a stroke. And this is all the same kind of disease process. It's cardiovascular disease. It's just a matter of whether it's in the brain or it's in the heart. So really, really important for people to be aware of all of those types of symptoms. And when they have them, to reach out immediately, either to go to the emergency room if it's critical, or if they're not sure, they should call their doctor to find out what the next steps are.
Okay, great. I was just going to ask that. Yeah, that next question, because I think most people don't know what to do when they have those signs. And I think the first reaction is to just ignore them, which we don't want to ignore them. Now, I'm an advocate for better to be safe than sorry. And it's never a waste of any time to reach out, call a doctor, go to the ER, go to urgent care, right? We have so many more resources available to us today. There's really no excuse for that, right?
Exactly. So, your options nowadays are, innumerable. You can go to an urgent care if your doctor suggests, like you said, which we didn't really have those options before. You could potentially get on a telehealth with your doctor and kind of go through things. You can have a phone call with them. And if it's very severe, you can go to the emergency room based on their advice and really know exactly what to do. But we have a saying in medicine that says time is myocardium, and myocardium is the heart muscle. So the longer you wait, the more the chances that you won't be able to salvage that heart muscle if there's damage from a blocked artery. And the same goes for the brain. Time is kind of brain. So, once you have those symptoms, immediately, the sooner we can open up an artery, if you are having an acute blockage, the better you're going to fare in the long term. So yes, there's no problem. If it turns out to be indigestion, wonderful. We'll be happy about that, but just be sure, you're right.
And they're hearing it right from you. You're the source, so no one should feel guilty about wasting anyone's time.
They can blame me. It's okay.
Yeah. So I recently heard the phrase, an ounce of prevention is worth a pound of cure. So is heart disease preventable, and what steps can we take to prevent it?
Yes, it is indeed. 80% approximately is what the estimate is of heart disease or cardiovascular disease is preventable. And, there is a component of it that is genetic. And yes, in your family, there may have been a number of people who had heart disease at a young age. And that suggests that you may have inherited genes that would potentially put you at risk for heart disease. But beyond that, there's also the component of lifestyle that is tremendously relevant to whether or not you're going to develop disease. So, you know, both are extremely important. And it's kind of fascinating how much one or the other, you know, plays into an individual's outcomes and what happens to that one person. But it really is important to understand what your individual risk is, and then to always work, even if you don't have a strong family history of heart disease, it's still extremely important that you do all the things from a lifestyle standpoint that will keep you heart healthy in the long term and keep you from having a heart attack or a stroke.
Now, they also say, of course, you know, diet, exercise, all are also key factors, right, in living a healthy lifestyle.
Yes. You know, the main things I would say, the way we teach patients and we work with them in what we call sort of cardiovascular risk reduction programs, that's what we do in prevention and in other places around the world, I would say, is we try to get certain risk factors for heart disease under control. So blood pressure, cholesterol, sugar levels, smoking, exercise, diet, weight, and potentially stress, you know, reduction, or I should say is really how you deal with the stress, not necessarily reducing the stress per se. So all of those things, if we can optimize each of those individual components, we always tell our patients it's highly unlikely that they will come back with another event if we really have optimized all of those things. And really, it takes some effort. You have to work with someone. Sometimes it's in a program for weight loss, or with a nutritionist, with a nurse practitioner who can educate you, with a physician, getting you on the right things. It's really a process, but it's a process that will not only keep you healthy in the long term, but it'll probably make you feel better. It'll improve your mood. You'll probably lose some weight. You'll, you know, perhaps be happier. So it's really an important process to prevent heart disease long term.
Well, I mean, I'm ready to dive into healthy eating because it's a huge passion of mine, and healthy food access is critical to most people, and it's something I advocate for all the time. So I've been working hand in hand with the American Heart Association on several initiatives to help improve people's ability to have healthy, affordable food on their tables. I'd like to say that food is medicine. And as you mentioned, Dr. Gianos, healthy eating habits can greatly decrease the risk of cardiovascular disease, right? So let me start by asking, what does an ideal diet look like?
That's a great question. And really, I do commend you for all that you're doing as we sort of discuss that, you know, we both are originally from the Bronx, and you've already started to get this back to communities that need the help, you know, so that's so important. This is not a theoretical discussion. It's about really changing what people are able to get and really make it doable for all patients. So yeah, so I think that the ideal diet for me, it's actually quite simple. And I think we get caught up a little bit too much, in my mind, on labels of what type of diet we're following, X, Y, or Z. And I think simply it is a diet that's predominantly plant-based, that all of the healthy components, you know, are abundant in that diet. So fruits, vegetables, whole grains, nuts, seeds, legumes being at the core of that diet. And there are probably 3 diets right now that fit that criteria if you eat in the correct ratio for heart health. So the Mediterranean diet, a vegetarian or a vegan diet, and something called the DASH diet, which is a dietary approaches to stop hypertension. These are all very similar diets. About 70% of each of these diets is those ingredients that I just mentioned. And the differences really are about what percent do we allow of the other components. So Mediterranean diet does also allow for a little bit of fish and small amounts of animal products in moderation, and olive oil and nuts and things like that. The vegan or vegetarian, you know, will perhaps not include, you know, some of those. And they're somewhat of a spectrum, I would say, of the same diet in my mind. It's just a matter of, you can even be doing the Mediterranean diet with a very large abundance of vegetables and fruits, or with less vegetables and fruits. So each of these is really a spectrum. The most important thing for patients to keep in mind is if they are able to get into their diet in smaller amounts and shift out one unhealthy component for one of the things that we're talking about, that's the most important thing for them to do. Just getting these nutrients into their diet is the most important.
Okay. So, I was always, I have two children, and as they were, they're teenagers now, when they were younger, I always would say to them, for every junk food, there's a healthy alternative. So let's go in the health food store and explore, like if you want a Cheeto, what could be a healthy alternative for that Cheeto? At least, it may not be the ideal food, but I always felt that it was better than all the other processed ingredients that they were having in a regular Cheeto.
Yeah, that's a
So,
great way to
no,
do
go
it.
ahead.
Eat this, not that. There's actually like a book, that's called that. But that's the concept. And working with a dietitian sometimes can help you. If you tell them, well, I like eating this, this, and that, they can help you find very similar, types of foods, but healthier versions of them. So you're right. Absolutely. If you just swap out one, and I always tell people, I still do eat a little bit of ice cream periodically and potato chips once in a while. I know they're unhealthy, but in small amounts. So we're not asking for perfection. We're asking you to simply try new things, do these in small amounts, and you'll see the difference. It's really incredible.
I agree. I mean, you need to incorporate things that you do really like as rewards or treats, and there's no reason why we can't have those. But the AHA always encourages people to eat colorful. To add lots of fruits and vegetables to their meals. So what are some of the benefits of eating more fruits and vegetables, and why are they so important?
Yeah, that rule I think is very helpful because it's simple. Just eat the colorful foods. Granted, probably doesn't apply to candy that's multicolored or anything like that in retrospect. But other than that, when you think about vegetables, fruits, these are things that come in a variety of colors, and the ones that are actually sometimes most bright and most colorful have a lot of nutrients. So, fruits will have antioxidants and minerals and vitamins in them, and a lot of fiber. Similarly, vegetables will also. And the key thing is that the effects of these are on a number of different things. So obviously, if you eat healthy, you'll probably maintain a healthy weight. You'll probably have better sugars, cholesterol numbers, blood pressure. All of those will be very important benefits. But also, you have a lot of direct effects in the body that are also reducing your heart disease risk. So, for example, whatever plaque in your arteries is there, you can stabilize that plaque. You can help it heal and keep it from building up further by eating things that decrease inflammation in your body, for example. Same thing with the arteries in the body. You can help the arteries to relax more, and you affect the inner lining of the arteries by eating these specific foods. So the colorful foods, truthfully, have perhaps the most of these heart healthy benefits. That's why it's important to always incorporate them in your diet. And the one thing I want to emphasize is that with respect to fruits, I think people just assume, oh, fruits have sugar, I shouldn't eat them, which is really, they're missing out there. So important to get fruits in your diet. You get, vitamins, you get fiber with them, and it's better to eliminate the other sugars that we're eating in our diet,
Right, no more processed. How do you know when you're getting enough fruits and vegetables?
I would say start small too. I think, certainly the more you can get in your diet, perhaps the better. I think that sometimes it becomes overwhelming to incorporate a lot early on if you're not accustomed to having them. So maybe just adding one serving, for the time being, and then seeing how you do. Really, each person's different. So if you have a patient who has diabetes, perhaps in some cases you may want to limit the number of fruits depending on their individual case with respect to diabetes. But for the most part, a plant-based diet has been shown to improve almost every disease state, including diabetes. So, it's not that if you need to eliminate fruit, specifically as a diabetic. So I think the goal at least of 2 servings of fruits, at least of 2 servings of vegetables each day. Interestingly, when they look at a study for the Mediterranean diet and they grade patients on the numbers of fruits and vegetables per day, when they looked back, those with the highest consumption of vegetables and fruits actually had the lowest mortality rate after several years of following them. So likely the more you can get in, the better, as long as it's in a balanced diet.
Okay, that's great. Very, very inspiring to hear that. How about sugar and sodium? Overconsumption, right? They say that it obviously causes serious health risks. Can you talk about the dangers of sugar and sodium and how we can work to reduce amounts in our diet?
Both sugar and sodium, I think, are potentially major risk factors for heart disease in the diet in different ways. And both are important. I think sometimes we like to sort of think of one villain in our diet and say, oh, if you just eat low sugar, then you can eat anything you want. Or if you just eat low fat, then you can eat everything. But the reality is both are actually very, very important. So with respect to sugar is very addictive. We have to know that. It's incredible. They've done research with mice years ago. Actually having both cocaine and sugar in the same sort of cage with the mice, and they showed that the sugar was more addictive, actually, shockingly. And if
Wow.
I myself used to eat a lot of candy, in the past and little things, and realize that once you start eating this and you get used to it every day, you really crave that sugar, but you can change that. You can actually slowly adjust and eat less, and you no longer want that sugar. As a matter of fact, you no longer get headaches and a lack of energy and needing a constant sugar fix when you actually make those changes. So sugar is really tied to a lot of inflammation and a lot of weight gain. It is tied to what we call insulin resistance, where even if you have insulin in your body, you're not able to store because it's just not as effective. So a lot of these things that lead to other disease states. So sugar is definitely a culprit. It's best to have things with a lot of fiber that have if they have sugar in them, they're actually not getting converted instantly into sugar because they're processed or they're low in fiber. So that's the key with sugar. And with salt, really, I think, usually you can tell to some extent what a salty food is when you eat it. But, you can also just be wary that certain things have a lot of salt and they may raise your blood pressure, cause you to retain more water. So soups, chips, olives, canned foods, processed foods all tend to have more salt. So just being aware of this on a general level and limiting as much as you can is really, really important.
It's very true about the sugar, because I recently weaned myself off because I realized that I was addicted, and it's so subtle that you don't realize until when you're really craving something. I knew my diet was off, and I shifted that around, but once I started having less sugar and I got past just like the first couple of days, I wasn't craving it so much anymore. I mean, it really is amazing. And how, and I tested myself over the weekend. I had some sugar and I just wanted more. Yeah. And it was like this reaction, and it was just so clear to me that astonishingly, how we are so just programmed to want that, and how addicting it really is.
Right. Yeah. No, I think it's great that scary. You share that. Yeah, it's incredible. And I've also learned, I used to eat a lot of sort of low fat things that I thought were healthy, pretzels, frozen yogurt, and things that I thought were fine. And I had no energy, had a headache very often. I was craving sugar, things like that. And I think what I've learned now is if people want to try out different healthy foods and just observe how they feel after eating them, Like now I'm like, oh, wow, that lunch, now I have energy and I feel well and I don't have a headache and I'm
Yeah,
not craving things. It's an amazing thing. I
it
mean, yes,
is.
my mom always said, you know, you have to eat these things. It's very good for you. But I was like, yeah, okay, whatever.
Yeah,
But it's
of course.
amazing. It's really important.
Yeah, it is. And I do notice that too. Like I'm not lethargic. I don't, I'm not puffy and swollen. And it's a great feeling. It really is.
Yes.
So everyone who's watching this is the truth. So pre-COVID, right? I think we all have at times struggled to find a way to eat nutritiously on the go. And even so now with the pandemic going on and more people being at home, I think a lot of those habits, and I know it happened with me, especially in those first few months, those healthy habits went right out the window. And I was just grabbing, whatever was there and, packing on, the COVID weight as everyone else did. Are there some tips or tricks you could tell us on how to maintain that healthy lifestyle, that healthy eating while we're, confined to these conditions?
Absolutely. The one thing I think COVID has done is maybe given us an opportunity to reflect on what it is that we maybe are doing well and maybe things that we could potentially improve in our lifestyle. And being home all the time is just a very big challenge. We talked about how, with some of my colleagues, being in the hospital during COVID, people were very, very respectful of clinicians and said, thank you so much for doing that. To be honest, we sometimes say that it might be easier to actually be in the hospital than to be home and not being able to help and just be stuck at home. And isolation is a tough thing, and a lot of patients are dealing with this, and we're seeing them and they're expressing how challenging this can be. There's not the usual activities, the things that you look forward to. You really don't have the social connections that are easily available. So I think one is it's important to always seek psychological help. There's people out there to help and help your mood, because that can actually help your lifestyle too if you feel better about what you're dealing with. But with respect to diet, yes, there's definitely some easier things. If you're home and you are willing to cook, sometimes really it's all about planning, I think. So if you can on a weekend maybe make a couple of things that'll make things easier during the week to have them ready and have them available, very, very important to do that. There really shouldn't be any issues with respect to either time or cost, though. If you don't have a lot of time, you can get things that are ready-made that are healthy, and you can just have them available. If cost is an issue and you need to be on a budget, again, you can also eat healthy on a budget. It's something that you just need to sort of be aware of what are the ways you can do that. Some easy things I think are, one is if you're ordering food, just to know wherever you're going to be. If you work in a certain neighborhood, then perhaps look at the places around there. If you're going to be ordering lunch, maybe look in advance and know what healthy options there are on those menus, so that you're not making a last minute choice and saying, I'll just grab a slice on the street, or I'll pick up a hot dog on the corner or something like that. Know what options there are that you can have, when you're ordering. Bringing food is always perhaps the best option. And I truly find that, even when I bring something, even if it's leftover or whatever, I find it's often better than rushing and grabbing something that I didn't really like and I just spent money on anyway. So I think if you can bring things, definitely. And I just bring a lot of snacks. Like I always have in my each different office, I have a cereal actually in little cupboards. I'm wondering if I have one. So usually
Love it.
I usually put them in there so that whenever I'm hungry, I'm not grabbing for something. I also bring, yogurts, like individual yogurts with me. I get one soy milk for the week. I put it in the refrigerator. I have it there. I, at home, make little smoothies with blueberries and a little bit of peanut butter and soy milk, and they taste delicious. So there's little tricks and stuff that you can do, and you can work with a dietitian also to give you more little tips.
That's really helpful. Thank you. Very helpful. Now, many of us are either just starting out on this journey to a better, healthy lifestyle, or we're struggling to adopt these new habits and behaviors. Is there an easy way to do it that's not so shocking or life-shattering to some?
Yes, no, I think right now I also tell people to give themselves like a little bit of slack. This is a tough time, so it's okay if you ended up, gaining a few pounds and you haven't, really been exercising or eating as healthy as you wanted to. And really, it's just a matter of starting. You got to set what we call SMART goals. They're small, measurable, achievable, realistic, and timely goals. So, nothing too crazy, something you can do. So some of the ones that I would suggest are things like just getting enough steps each day. And you have to sort of hold yourself to it. And if you do it for several weeks in a row, you'll start to notice that you feel better, you have more energy, and hopefully you'll stick to it. So just really steps is one easy one. Another one with exercise, a friend of mine, because there's a lot of things, most things are closed right now, your usual exercise class and stuff. And, it's hard to get motivated to do your own exercise. So she and I do a FaceTime together at in the evening, a couple times a week. And we literally do our planks and then we do our push-ups and then we do our whatever, just to motivate ourselves. And it's actually because we chat, for a little bit and we're doing the exercise, it's not as lofty of a goal because I don't mind it as much as I would have, putting myself through some rigorous plan and stuff. And with respect to diet, I think, again, it's very simple things. One is just buying, in order to eat 2 servings of fruits and 2 servings of vegetables a day, you actually have to buy those and then actually eat them. So very simply, what I do is I often, even on the street, will pick up, on my way to the office, and I'm usually sharing fruit with various people. Sometimes I'll get a whole thing of bananas, but, blueberries, blackberries, various things, just making sure to get those servings. Same with vegetables. I'll buy, a thing of the small cucumbers or different tomatoes and eat the cucumbers with hummus. Really easy things, but really you have to plan in ahead and say, okay, if my goal is to eat 2 servings of fruits and vegetables a day, how am I going to do that during the week? Am I going to buy a ready-made salad? Am I going to make something at home? Is it going to be my snacks? So really just thinking about something that you can do that's not too lofty, as you said. I think that's a key message.
Yeah, I mean, that's why I guess maybe, most of us fail is because we, our expectations are greater than our commitment.
Right.
Right. So that's really helpful. I love that. I actually, I also have a tracker, a fitness tracker, and had put it away for a while. And then I took it out like 7 months ago and make sure now that I hit those daily steps. And when I don't, I get upset because it's one of my goals. So
That's
hopefully
great. Good.
other people will incorporate it as well.
Yeah, good for you.
I'm getting there. I'm getting there.
Trust me, it's a process for all of us. And I dealt with the same thing. I wasn't motivated in the beginning. I gained a couple of pounds. I was, frustrated, that I wasn't able to do my usual things, but, it's a process for everyone,
Yeah, and we've all been there. So this is so helpful. And I know that this video and this information will touch so many lives. So I really do thank you for that. Is there anything else that we should be aware of or know or any tip?
Sure. I think that one of the messages that I want to make sure gets communicated is what you asked about before, the fact that this disease process is largely preventable. So people really need to understand their own risk. So knowing what your exact family history is and who in the family had maybe a heart attack at a young age or a stroke or whatnot, and maybe even meeting with a cardiologist or a preventive cardiologist, someone who can go over your risk and make sure exactly how you are going to do everything in your power to make sure that you are not one of the people coming into the emergency room with a heart attack or a stroke. So I think having that, one-time assessment, knowing exactly what's going on with you individually, and then really working on all the lifestyle components that you can achieve on your own as well.
That's great. Great advice. So thank you so much.
Sure.
I really do appreciate you and all that you do.
Same here.
Thanks.